So hello guys, good morning. So the time is right now. How much? The time is 6. Okay, 6 a.m. Okay, so let's continue our discussion further. Okay, we are until where, Amma? Until we completed this table, and we are going to start the family cycle. Okay, see, it is they will ask in the PSM. See, always they are going to ask the one question from the family cycle. Remember, they're going to ask the simple question, the definition only. Okay, na? So, what is formation? Formation means what? Marriage. Okay, na? Beginning of marriage, and what? At ending, what is birth of first child? Marriage, birth of first child. It is called as formation. What the extension? Birth of first child and birth of last child. Like this one, they will ask. Okay. Until now, there is many MCQs. They ask for only the definition only. Okay, na? The important one is formation, extension, and this contraction. Contraction and complete extension is the first four. The first four is important. Okay, remember that one. Next, coming to this one, limiting acid. Limiting acid water deficiencies. You have to remember the what limiting acid in the cereals, pulses, and majors here. They are also very important. Okay, now if you have any mnemonics, then you can okay, you can remember like that one. Okay, now how I do remember is that, see, serials ra. Okay, now there is a what? There is a TV serials. Do you know TV serials? Okay, serials is a 309 means what? 309 means at 3 o'clock. Like most of the girls, women, they're watching the serials at afternoon only, because there is no more work. There is no more work, so they just lie down, and they will watch the serials at 309 at 3 o'clock only. Okay, na? So lie down, lies in at 309. Okay, next one, pulses. Yes, there is a what? There is a pulmocyst. Okay, what is a pulmocyst? There is a pulmocyst, methionine, cysteine, and pulmonine means what? Pulses. Okay, mage means what? Mage. How to remember this one? Mage water maja. Okay, na? Mage means maja. Maja in fan. Okay, na? Fan. I lie down, and fan maja. I'm doing maja. Like she tiptoe fan with the maja. Okay, and lie down. Okay, next one, they will ask you this one, toxins, and which is disease, toxin and adulterants. They are going to give a case scenario, and they will tell that uh, they will tell some case scenarios, and how to identify what type of disease is that. Okay, the most commonly they are going to ask this one, letharism and epidemic dropsy. Sometimes, rarely, they ask for this one. They ask for this one, endemic ascites. Okay, so mostly they are going to ask this one, and they are going to mention in the question that, so for example, this guy, and he ate this one. He ate in Watama kesari dal or Arjuman Mexican oil. Okay, so meaning how to know, if they say that, okay, kesari dal means what is the toxin? Toxin the boa. So for example, this says that they will tell a case scenario, and they will tell that he ate the toxin boa, and what the patient may going to land up into. So you have to tell, okay, it's going to be lethargism only. Okay, na? In further videos, I will tell you each and everything. Okay, now about the lethargism, epidemic dropsy. Okay, na? Don't worry. Okay, this is the this is the neurotoxinoma. Okay, na? I will tell you. Or else you can just and search in your notes about the letharism and epidemic dropsy. Because these are very important. Okay, na? They are very important. Okay, just remember the toxins and the disease. Okay, and adulterants. Okay, next one. This is sometimes they will ask you this one, image based only. The same image will come. Okay, the same image will come. Okay, and they're going to mark here A, okay, B, and C here. Okay, sometimes C here as okay. They're going to ask you. So they will ask you what is A here. What I have okay, screen time, lead time. Okay, na? Then see what is lead time. Lead time is what here from here. First positive point to usual time of diagnosis. See, disease onset, first possible point means you have to we are guessing the diagnosis. Okay, na? Final critical point and usual time of diagnosis and outcome. So first possible point to final critical point is the screening time, and first possible point to ask diagnosis. Okay, that is what this is lead time. That's how they are going to ask the questions. And he coming to here. There is a achondroplasia. Okay, achondroplasia is it is a what? Autosomal dominant. C achondroplasia AD. It is autosomal dominant. And there is a what? It is a related to the what obesity neurological problems, delayed in the motor milestones. So recognized at the birth by what bowing of the legs here. See here, they will give you one classical sign on the X-ray is that there is a champagne glass appearance. Okay, or champagne glass appearance. Okay, don't worry, they will mention all this in your exam and you have to identify. Okay, na? The next coming to the ankylosing spondylitis. What is ankylosing? Ankylosing means what? It's meaning fusion of the bone. What? Fusion of the bone. So there is a joint. Okay, na? Fusion of the joint. So if the joints will going to fuse, then what happen? See here on the X-ray bar. In X-ray, you will see that there is a what bamboo. Okay, there is a what bamboo sign. See, all are fused. Okay, there is a bamboo sign on the what on the X-ray X-ray. And remember, it is a he also associated with the what uveitis. Okay, na uveitis and a joint fusion. Okay, na the most common joint is what sacroiliac. Okay, na sacroiliac joint. Okay, na these are the very important findings. Okay. The next one, you can see here, this is having the what cuppings like okay, cupping like here, it is a rickets. Okay, na it is a rickets, and here is the what this is the osteomalacia here. So rickets in the children's vitamin D deficiency, and rickets in the children's, and osteomalacia in the where in the adults only. Okay. Next, coming to the osteoarthritis and the rheumatoid arthritis, these are very important. So in the you have to only remember one thing in the one thing. Osteoarthritis means what? Osteoarthritis means what? There is a loss of what? Loss of the osteo bone arthritis means inflammation. So there is a bone inflammation. Why? Why? Because there is what? There is a loss of what? Loss of destroyed the articular cartilage here. Okay, na? That's why there is inflammation. That's why there is always a very wears and a tear. Okay, na? See, by if you have the knee pain, guys, if you and still you are like bearing the weights. Okay, na? More than of your body weight, and that's why what happened. All the cartilages there they're going to destroy here. Okay, na? गठिया भी बोलते हैं हिंदी में. So okay, now but here what here it is the what here rheumatoid arthritis is a autoimmune condition, but osteoarthritis is a what it's not an autoimmune condition. It is going to be articular or there is a degeneration of the what articular joint here. Okay, na? The main important one is the here. The main important one is here. See, there is a see. Okay. In the see, this is the rheumatoid arthritis and the osteoarthritis. See here. In the rheumatoid arthritis, what happens here? There is going to be what pannus. There is a what there is going to formation of the pannus. Okay, na pannus formation, that is synovial fluid proliferation. See, there is a what pannus. There is a pannus formation. But what here? There is a cartilage loss here. There is a cartilage loss. That's why whenever we will move, there is a what sound, tuck 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 while while moving. Here it's very painful condition. Okay, na? These are the very, very important one. You have to know. And see here in the osteoarthritis, there is a watermark. There is, see, this is the normal. You will see the gap here, but there is no gap. Meaning watermark, there is a particular watermark, there is a degeneration. Okay. See here, see here, HD here. Okay, HD means watermark. Herbitant, this is herbitant nodes at the DIP and the Boucher's node HP at the what at the PIP. These are the main important, and treatment is the bottom. This one. You have to do the PRP. We have to do the PRP therapy also at the last two results. Okay, at the last result, it is the TKR. Okay, na? It's TKR means total knee replacement is the standard. But here you have to give the immunosuppressant. Okay, then these are the important one. Okay, these are the important findings you have to remember. Next, coming to this one, this is the comparison of a sterilization methods. Everyone knows about that one. Autoclaving, how much temperature you are using, hot air, how much we are using, and what we are doing this one. These are okay. Like everyone you can remember. Okay, knows about that one. Now coming to this one, coming to this one, nephrotic and nephritic. Okay, how much nephrotic and nephritic. Okay, na. So what is this? See, nephrotic watermark, nephrotic means watermark. There is a what more protein loss, and nephritic watermark. There is a fry red means what fry means red kada. So the fry is inflammation of the kidney that leads to the gross hematuria. That leads to the gross hematuria. So see here, there is a massive proteinuria here in the case of the nephrotic syndrome. See, these are the findings here in the nephrotic syndrome. What the nephrotic syndrome? What will happen, Amma? Yeah, okay, na? What will happen, Amma? There is a hypoalbuminemia. There is a hypoalbuminemia. Mean there is a what? There is a less albumin. That's why the patient will get the edema here. There is a increase in the increased thrombosis. Okay, now increased thrombosis here. There is a increased thrombosis here. So guys, this is what happens here is that, and there is a hyperlipidemia also in the case of the in the nephrotic amount. Okay, but here there is a gross. Here is a grass hematuria, azotemia, there is RBC cast here, there is a oliguria, okay, na? Here in the case of the nephritis. These are the main important one. Remember, what is the most common cause of the nephrotic syndrome? Okay, it is the what? Minimal changes. While coming to going to the nephritic, it is the PSGN. Okay, na? If in adults, it is the FSGS. Okay. Now coming to this one, nephritic and nephrotic. So nephritic, see nephritic and nephrotic. Nephritic, I think you guys know about this one. So if there is a history of if there is a history of any skin lesions or any like sore throat only, how much 2 to 4. How much? 2 to 4 weeks. Okay, na? 2 to 4 weeks. 2 to 4 weeks after that one, the patient will having the patient will land up into the cola color urine, and there is a gross there is a gross hematuria. Then it's going to be your case of the PSGN. PSGN. But remember here, if the infection will come, if the after the skin lesion, if the infection is occurs within 2 days of the infection, okay, na? If the if the massive proteinuria occur within the 2 to 3 days after the skin lesion, then it's going to what's what IgA nephropathy. Got it or not? Okay, now see in the PSC, you have to see the duration, the 2 to 4 weeks after the infection. But here in the burger, this is what it's going to be what within 2 days of the infection will get the massive proteinuria. Okay, this is called what IgA nephropathy. IgA nephropathy. Okay, na? What is IgA vasculitis, Amma? IgA vasculitis, it is a tell Bolo. It is a HSP. Okay. That's done. See, on the light microscopy, there is a enlarged and a hypercellular glomeruli. On the immunofluorescence guy, there is a starry sky. There is a starry sky, like appearance of the for whatever or mesangium. Okay, na mesangium looks like the starry sky. Okay, na. Yeah. Next one, coming to the here. See, and also on electron microscope, there is a subepithelial humps. Okay. What is the treatment for here? Or to do the supportive care and use the antibiotics. That's really great. And Ajay Nephropathy, I said that what am I? How you are going to differentiate between this? How you are going to differentiate between the Pyqs and the IgA nephropathy? Okay, but they are not going to ask more about this nephrotic. But you know what? The nephrotic is very important. Nephrotic is very important. Okay, na? So I will tell you this one. I will tell you this one. I said that as I said that what is the most common cause of nephrotic syndrome? It is what am I? It is first one is the minimal. First one is the minimal change. Minimal change disease. Okay, na? Please remember, what is the definition? What is the definition of the nephrotic syndrome? Please write with me. Please write with me. Okay, na? If the urine protein, what am I? If the urine protein is a 40, okay, na? 40 milligram, okay, milligram, okay, meter square per hour. What am I? Sorry for the per hour. Okay, na? Right. Write down. Okay, na? If the urine protein is more than 40 milligram meter square per hour, or 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 urine protein, how ma? Or urine protein is to and a creatinine ratio is more than 2. Okay, now tell me if the urine protein is more than 40 milligram meter square per hour, or urine protein is to creatinine how much? More than 2, or urine protein is how much, amma? More than 1000. More than 1000 milligrams. Okay, now write down. Write down. If the urine protein is more than 1000 milligram meter square per day. Okay, now. Okay, now this is one criteria. Next one, what the urine protein is more than 40 mg meter square per hour, and urine protein to creatinine ratio how much, more than 2. Then it is the classical presentation of the nephrotic syndrome. Okay, now I just said that there is a hypoalbuminemia and these are the changes. Okay, now remember, and they're going to ask this one, and also remember uh, how you are going to manage the nephrotic syndrome. How you are going to manage the nephrotic syndrome. Okay, now let's see. See here, we will discuss the first one is the what is the most common cause of the nephrotic syndrome. It is the what your minimal changes. Okay, minimal changes. So see here, minimal changes is they will give the age what 2 to 6 years, and the most commonly in the boys is seen in the case of the 2 to 6 years. It is also called a lipid nephrosis. Okay, because there is a what more number of the TGA will be what the TGA will be increased. See here, for nephrotic syndrome, it is the what are triggerants? Triggerants is the recent infection or immunization or immune stimulus. For example, if the patient is diagnosed with the nephrotic syndrome, if the patient is having any vaccinations or any recent infections, then what happen, amma? It will trigger, and the patient may they all and the patient will again will land up into what, amma? Nephrotic syndrome. There is a relapse here. Okay, na? It is also second to lymphoma, example cytokine immediate damage. Loss of antithrombin, it leads to what renal vein thrombosis. Okay, na? Renal vein thrombosis. Remember here one thing here. Remember, I just said that. So, okay, na? These are our parents. These are our parents. Okay, these are our parents, and this is our children's. Okay, na? Children's are what? Children are always say that to hello, namaste, Papaji. Okay, namaste. It means what, parents? What parents? बच्चे लोग क्या करते हैं, बड़ों का फुट छूते हैं, बड़ों का they will touch the parents feet, okay na. That's why what amma in the nephrotic syndrome, what amma, if you see in the light microscope, you see light, no light means no, there is a normal glomerular immunofluorescence is also nil, but on the electron microscope there is a effacement of the pore cyst, okay, and the effacement of the pore cyst of the foot, okay na. Then see here, means the loss of food process of the parasite. Okay, na. See, remember, remember the treatment part is very important. The treatment part is very important. Okay, na. Remember, what is the treatment of choice? It is the corticosteroids. It is the corticosteroids. Example, what am I? Prednisone. What is prednisone? Okay, prednisone. What is the dose? It is the 2 mg. 2 array 2 mkd, okay na. What am 2 mkd, what is that dose is the water 2 mkd, okay, milligram kg per dose. But what is the maximum dose we will given 60 mg, okay na. What is the maximum dose? 60 mkd, okay na. But we'll start with what am 2 what am 2 mg kg per dose, okay na. Until how much? You have to give 2 mg, how much amma, for until 6 weeks. What am until 6 weeks? After that one, after the 6 weeks, we have to decrease the dose and you have to follow how to do the what am decrease the dose and you have to give how much? 1.5 mkd for the what am alternate days. Okay na, alternate days, alternate days, okay na, alternate days, okay na, until 6 weeks. Okay, alternate days until 6 weeks. You have to give this one. Now tell me first how much? 2 mg, 2 mkd until 6 weeks. After that one, you have to do the you have to give 1.5 mg, 1.5 mg kg per dose. And the alternate days you have to give. Okay, now that is how much? 6 weeks. So the total duration how much? It is going to be 12 weeks duration. It is total is the 12 weeks duration of the to management of the nephrotic syndrome. If the okay na, remember if it is what if the patient is having the showing symptoms of what? Steroid deficiency, okay na, steroid dependent. It is steroid dependent. If it is steroid dependent nephrotic syndrome, then what is the drug of choice? Drug of choice is going to be what? Levamisole, okay, levamisole or cyclophosphamide. The patient is having showing the steroid resistant nephrotic syndrome, then your drug of choice is the what uh for the resistant is the cyclosporins, okay? They are the what? Cyclosporins, your drug of choice, cyclosporins, okay na. Done. Please remember this is very important, okay? That's why I lagged here. And also remember most common is the immunization disease in the children, but most common in the adults is the what? FSGS, okay na. So if the this one they will give the history as like there is a patient with the HIV, okay, the patient with the HIV and he was doing something and he got this one, meaning if you say the history of HIV, meaning they're asking about the hepatitis, okay. Next, the next one is the Alport syndrome. Remember here Alport syndrome. Here is the Alport syndrome. Here this is the type 2, type 2, type 4 collagen mutation. Mostly is X-linked dominant. See what here in the Alport syndrome. There is a what SN, there is a sensor or neuro hearing loss. See, patient will can't see, can't hear, okay na? Can't hear be, can't be and can't hear, okay na? He can't see means having the conjunctivitis and can't see arthritis and can't hear is a H has an HL. These are the symptoms they're going to give for the Alport syndrome. Just remember, okay na? There is what am I see? This is the Berger disease. This is the Borger disease. This is the Berger and Borger disease. Okay, now this is the TAO conditions. Okay. Okay, next one, there is going to be a polycystic kidney disease in going to adult and infantile. In adult, this is the dominant C. D for dominant is for adult. Okay, na for recessive, this is what recessive small children. Recessive small children here. What happens, Amma? Here is there is a multiple cyst here. There is a multiple cyst here. In the case of the what, Amma, in the PCID and in the adult here. Remember here, these are the symptoms. Remember, there is a mutation in the genes encoding what PKD1. In the PKD1, at the what chromosome? It is the 16 and 4. The 16 and 4 here. Uh, uh, they're going to test you. Remember here, they're not going to ask this, but they're going to ask which is the most common in the children. This is the autosomal recessive and adult is the autosomal dominant, and they're going to give they're going to give these images. Okay, they're going to give this image, and then you have to identify. If there is a fibrosis, there is a cyst plus fibrosis. It's going to case of the watama. Your dominant. You are in the dominant conditions are recessive conditions in the children. Okay, children. This is in the adults. Okay, very simple. Remember, many cyst is adult and fibrosis plus cyst. There is going to be what your children in children in infantile condition P. Okay, na? The next one is going to be a conjugated and unconjugated conditions of the what your bilirubin conditions. Uh, these are also very important. Okay, na? Most probably they're going to ask you. We are going to ask you which is okay, na? Which are the what are the diseases associated with the conjugated conjugated hyperbilirubinemia. So conjugated waterma, there is a see Dubin. There is a Dubin Johnson syndrome and Rora syndrome. Okay, na? The conjugated are direct. Conjugated are direct bilirubin. There is going to be your Dubin-Johnson syndrome and the Rota syndrome. Okay, now see doctors are always conjugate. Okay, na doctors are always conjugate. Okay, na that means remember D for Dubin-Johnson syndrome, R for Rota syndrome. Okay, na conjugated. Unconjugate what amma? See, if you know conjugate to them, then what amma? All are unconjugate only. So these are the very important. They will ask you which of the following is not a disease of the conjugated. So they will give this one. See, very simple. Okay, they're not going to ask what is the enzyme deficiency, E deficiency, tokka tolu, no, nothing. You But if you want to master, then you can master. But others no need. Okay, okay, na? But until now they ask like this, but right now you have to remember what is the deficiency here and what is the deficiency here. Okay, I'm not going in detail, but if you want to remember, then Gilbert syndrome and Dubin-Johnson syndrome is very important. Okay, remember this in the first heart sound coincide with the pitch phase. Obviously this is going to be your isometric or isovolumetric contraction only. Okay, na? Here the first sound also isovolumetric contraction here. S2 isometric is the S2 means what? Very simple, right? What? Next one, remember this one. There are some baroreceptors here. Okay, na? I think you know about baroreceptors is control the BP. Okay, na? Remember, there is a serious reflexes here. There is a Bain bridge reflex. Bain bridge reflex means what means there whenever there is a increase load on the right atrium, increase pressure on the right atrium, what happened, it will give a signal to the water medulla and it increases the sympathetic activity. Then there is going to be increase water, there is going to increase in the heart rate. Okay, this is the case of the if there is a see if there is a why there is going to be increase in pressure in the right atrium because what happened there is a fluid overload. There is a massive fluid. If there is a more fluid accumulation in the right atrium, there what happened there is a pressure will be more in the right atrium. So there is going to be what in the medulla, there is going to be your, they will activate the whatever sympathetic activity, and what happened, there is going to be increase in the heart rate. That's it. Next, coming to the Bejolta, coming to the Bejol reflex, Bejol Jadis reflex. What am I? See, Bejol means what am I? Means old patient. Old patient before bradycardia. Okay, now see the patient will land up into apnea, bradycardia, and hypertension because in the old patient guys, the patient with any like a MI or a stroke patients. If you are going to give the IV, okay, IV irritants, okay, IV irritants, then what happens, Amma? There is going to be there is going to be the suppression of the what, Amma? Going to suppress the what medulla, and so what happens? There's going to be what okay, na? There's going to be the patient will land up into what, apnea, bradycardia, and hypotension. Okay, na? Injection of a capsicum, anything, okay, na? In any chemo test, if you're going to give that one, they're going to decrease this one. Next one, okay, they are very important. Why are no cool here? That next one, these are the last updated in the medicines here. You have to remember this one, some important points. See, next portion yojana is the incentives increase from 500 to 1,000 rupees. As everyone knows this one, India free from trachoma on Ottoman 8th October. Nephritic, India launched the antibiotic for degradation pneumonia. Kit is introduced for which is the brown color for the undirected discharge. IPC name changed to Watama Bhartiya Naya Sanita. Next one here, only this one. Next one. Next, elagolic sodium oral generalized for the endometriosis, fibroid, and heavy menstrual bleeding. These are the new one. There is a new regimen for the treatment of the MDR TB. Okay, now. That is the bedaquiline, petromyde, and moxifloxacin. And also there is a new thing for the, there is a new changes in the TV, but don't worry, but it's not in India. It's in India system, it's not updated. Don't worry, but you have to follow the old one only. Okay, na? Follow the old one only. Okay. Yeah, this one only. This one only. This is the new one. Okay, na? Remember this one. If they ask you according to the new one, that if they mention in the option, if they mention the moxifloxacin, then you can add the moxifloxacin. But no, but others no need. Okay. So these are the indications. Don't worry about it. Okay? State color code. See, kit 1, kit 2, kit 3, kit 4 here. See, kit 1, what is the watermark? Kit 1, remember, kit 1 is the gray, gray watermark, the urethral for the urethral discharge, urethral syndrome, okay, na? Painful scrotal swelling and epidemiological treatment for your, it is the kit 1. Kit 2 is the gray, is the green color for the vaginal discharge and syndrome. And people, please remember for the remember here for the vaginal erosion. Okay, na? For the vaginal erosion here, for the vaginal erosion, it is going to be kit 1 only, not kit 2. Vaginal discharge is the kit 2, but vaginal erosion is the kit 1 only. Okay, na? Okay, na? Remember here W, C, white, blue, C, C, WBC, WBC, okay, na? WBC. W means water is white, blue, and C means water, red, okay, na? C, remember I this one, okay, na? W is white 3, blue 4, and red is 5, okay, nice. Red means water, congestion only, na? You have to remember like this one. Yellow is the 6 one, black 7, and brown is the 8 one. Okay, now like they are going to use you some case scenarios, and you have to then they will tell that what kit you are going to use for the treatment of this condition. So for example, they are going to give this one lower abdomen. They are going to give the case of the patient is suffering from the PID or lower abdominal pain. Then what kit you are going to use? You are going to use the kit 6. Okay, yellow one. Okay. Oh, then we are here at this is the watermark. This is the sandfly, Kala Hajar, which causes the visual leishmaniasis, is Kala Hajar, and also called as the cutaneous leishmaniasis, or it's called oriental sore, a Delhi boil, or Baghdad boil. This is the Watama red. This is the Watama your red wig. This is the red wig big red wig bug, which causes the American trypanosomiasis. This is also called the Chagas disease. Okay, okay. Next one, this is the rat flea. It's called a Genospella Theopsis. It causes the bubonic plague and the endemic typhus. Endemic typhus and also called the chigerosis. Okay. Just remember the images are very important. The sandfly, red wig big. This is the Genospella chigerosis. These are the lows here. These are the software. Na? Louses are head louses. Okay, na? So what are the disease transmitted by this one? The endemic typhus. Okay, na? Your endemic typhus, lapsing fever, trench fever, pediculosis. Okay, na? Uh, okay, na? These are the types. They're going to give the options here. So you have to give this is head louse, body louse. Okay. Oh, this is the head louse, the body louse, and this is a crab louse. Okay, head loss. So what are the fever they're going to give? Epidemic typhus. Okay, na? Next one is the ticsra. They're having a soft and a hard tics. Okay, na? This is a soft tick and this is the soft tick. Soft tick and a hard ticks. Okay, na? So they're going to give what are the diseases which is going to carry by your soft tick and hard ticks, and others they are going to give the image only images and you have to identify. So soft tick, Q fever, KFD, and reaction fever. Hard ticks, KFD, Indian tick typhus, baby assisted, tick encephalopathy, and the tick hemorrhagic fever. That's what they're going to cause. We are the caused by the hard ticks. Okay, na? Hard ticks. Okay, very important. Next one is Sira, single exposure point source epidemic. See, point source. Okay, na? See, point source watermark, there is a clustering of cases in one incubation period only. Example, there is a sudden rise and there is a sudden rise and there is a sudden fall. Okay, na? There is example is the food poisoning. This is single source. Multiple source of asthma, there is a sudden rise, secondary waves due to multiple exposure, multiple clustering of the cases. Example, typhoid due to contaminated well water and the pond and wall. Okay, now see, food poisoning will happens like yes, see, food poisoning will happens in the food poisoning from the one shop only in the from one house. But what happened here, this is only the point is only one source here. But what happens in the typhoid fever due to contaminated pond? What happens? Multiple source exposure. Mean you see everyone, okay, na? Everyone will drink that water. That village water means everyone will go into what multiple. There is a multiple contact. Okay, na? So this is the what radiation hazardous here. This is the symbol here. This is the non-radiation radiation. This is the non-ionizing radiation. Okay, this is the biohazard. The dental processor. This is the Harax apparatus for the what you are for the chloride. Okay, na for your bleaching powder. Here you are used for the estimation of the chlorine demand. Okay, na this is your Harax apparatus. This is your chloroscope. This is your chloroscope. Measure the amount of free residual chlorine in water. They will ask you questions. Are don't worry. He will ask questions. They will give this one. They will say, what is this? What is the use? You have to know. You have to know. Okay, this is your. Okay, this is our atoma. Is for the measure the amount of free residual chlorine in water. This is also important. They will give. Okay, na? In your community, guys. This is the whole community. This is the whole community, and they are the hypertensive subjects here. How much members how many members are diagnosed with how many are treated and who are adequately treated. Okay, now so how they're going to ask this is the what employee state insurance by Ministry of Labor, Government of India. contribution employees how much are 3.25% of wages, and for the employer and employee is the what how much 0.75% of the wages. Okay, na? Sickness benefit are 91 days. They will provide 70% of the wages, and the extended sickness benefits is the what how much 2 years. For the maternity benefit is the 26 weeks, and they will give how much 100% wages. Oh my goodness. Okay, this is what sling. This is the sling psychometer. Can you tell me where you will see the sling surgery? Sling surgery where sling surgery for the what tell me. Prolapse. Yes, correct. Yeah, prolapse cases. The in the OBG, you know, see, this is a sling psychometer used for the to measure the air humidity. This is the cartometer. This is what carta thermometer. Carta thermometer used to measure the low air velocity or cooling power of the air. This is the wind vane. This is the wind vane for the detection of for the direction of the wind. Okay, na? For the used for the direction of the direction of the wind. And here this is the carta thermometer for the measure the low air velocity, cooling power of air. The sling surgery, this is also sling psychometer for the measure the air humidity. Air humidity sling psychometer. This is your this is your female Anopheles mosquito. Vector from where everyone knows about the malaria. The black spots on the wings. Okay, it's the black spots on the wing. And with wings, you see here 45-degree angle with surface, larva parallel to the water surface. You see here, larva is parallel to the water surface, but here it is not parallel. Okay, now the larva is not parallel to the water your water surface here. See here, see the okay. We are done with the mosquitoes and female Anopheles mosquito. Okay, remember always female only toxic. Okay. Next one is the Aedes aegypti mosquito. This is vector for the dengue, viral fever, okay na, yellow fever, Zika virus, okay na. As you know, Zika virus is the what is the dengue here. Next this is the Culex mosquito. Culex, this is a hump like Culex is the hump like, okay. Hunchback appearance is the Culex mosquito. This is the Mansonia mosquito here. But for the Brugian filiasis, and there is just sparkling. This is the what sparkling on the legs. See here. Sparkling on the legs here. Larvae along rootlets of aquatic plants. See. Next one, this is your infantometer for the measure the length up to what 2 years. This is Sakira step for the measurement of your what mid-term circumference. This is your Salter scale. This is your what Salter scale for the measuring the weights in the ICDS activities. This is your what herpidens. See, herpidens, herpig means pig means what there is the skin fold. Okay, no. Just remember the mnemonic like. This is vaccine carriers which carries 16 to 20 vaccines. Vials can be carried located located at the level of what sub center or village. There is a 4 packs will be stored here. How much 4 and how much vaccine? 16 to 20 vaccine. This is what this is the Janani Shishu Suraksha Karyakram. See, Sushu means what? Sushu means toilet in what color, Amma? It is in the what color? Tell me. It's also yellow only in the toilet too. That's why this is the what color? Yellow color. Is the that's the third. Remember, Janani Sushu Suraksha means Janani Shishu Suraksha. Remember, Sushu means what? Amma toilet. Meaning yellow color. It's also yellow color. That's for remember, sir. Janani Shishu Suraksha. Free diagnosis. Okay, now free diagnostic and free diagnostic, free drugs, free delivery, free diet, free. Okay, na blood transfusion, free delivery are the components are newborn care, newborn stabilization unit, special newborn care unit, and there is what home-based new care. So these are the components there. Remember, this is also questions of PYKC here. This is the waterma vaccine vial monitor. See, remember here, this is good. See, mini waterma. I think everyone knows about this one. If there is any black color, see, if it is still white here, then it is good only. Okay, na? But here still white. Okay, na? The the center square is lighter than the surrounding circle. Okay, na? See, this is good to use, but this is not good to use because there is waterma. There is water. This is more dark here. This is the completely dark. So you have to see after whenever you are going to use the open the well, when you're going to open the well on the vaccine well, you will see this one. Okay, na? If it is if it is full white, then you have to then only you have to use the vaccine. This is also acceptable. Still white, but if it is not, then you have to not use the vaccine. Okay, now you have to discard the vaccine. Okay. See the mission Indradhanush, mission Indradhanush. It is height watermark. It includes 100% coverage for 11 vaccine preventable disease by 2020 catch-up campaigns, TB, polio, diphtheria, pertussis. Remember from the mission in the Dhanusra, 11 vaccines are total. So remember this one. So they will ask you questions. What vaccines are included in the mission in the Dhanush? Okay, this is the 11 vaccines here. The next one, the switch means national switch day of India. So switch from that trivalent OPV was to bivalent OPV. Okay, can I continue or I will continue another day? So next one we are having the okay, I will continue on that day. Okay, from here. Okay, thank you very much. From 240, I'll continue. Almost I will complete on the next. Okay, this I think next. So okay, I think your next session is going to be your last one. Okay, thank you very much, guys. See you. Please study hard. Huh?